Okay, guys, we're going to move on to one of the most important chapters in the book, childbirth. So it's a normal, natural process, obviously. And the things we need to be looking out for is to try and determine when this kid's going to come out. If we can take him to the hospital, do we have to determine, do we have to deliver in the field? And the two things we can look for there are the frequency of contractions and crowning, and we'll talk about those two things. But first, just a quick kind of anatomy and physiology review. So the ovaries produce eggs. They travel in the fallopian tube to the uterus, where then the egg becomes a fetus and goes from there. So you got to know these three stages of labor. Okay, there's three stages. Got to know them all. So first stage is I call it preparation. So the uterus is starting to contract. The bag of waters breaks. Amniotic sac breaks. The bloody show occurs. But the infant's head does not appear, okay? So first stage of labor, if you could attach one word to it, it would be preparation. Okay? Second stage of labor, this is the actual birth of the infant, and you will see the head starting to come out. We call this crowning. So crowning is when you kind of see the crown of the head, right? And that means there's no time for transport. That means this baby is coming out right now. So if you see crowning, get your gloves on. Okay, third and final stage is delivery of the placenta, or the afterbirth, as some people call it. So the placenta is usually delivers about a half after the baby comes out. So so here we are. If you get to a call to some sort of pregnant woman and there might be going into labor, these are some of the questions you should ask, and it can really help figure out where you're at. So, is this the woman's first pregnancy? A woman experiencing her first labor will take a long time. Okay, but if a woman's this is her fifth kid, I mean, that kid's going to come out real quick. The body just gets better and better at the birth process. And so the more children that women have, the faster the labor process seems to go. Has the woman experienced the bloody show? Remember, that's part of that first stage. And then has bags of water broken, same thing. You've heard that, oh, my water broke? Yeah, same. That's what we're saying. When those start to happen, baby's on the way out. So another thing is the contractions, right? So if the contractions are less than 2 minutes apart, it means that birth is probably going to occur pretty soon. So 2 minutes, okay? 2 minutes, 2 minutes, 2 minutes. That's the keyword thing you should write down. Contraction timeline, less than 2 minutes. Does a woman feel an urge to move her bowels? Sometimes that can happen, but we don't want to go to the bathroom or anything because the kid could actually come out in the toilet. It's actually happened before. So we want to really prepare for labor at this point. So as the head's crowning, we already talked about that. Then we can look at how far is it to the hospital, what is the ambulance, which kind of ambulance is responding? Is it like a paramedic rig? Do you have supplies for it? And then, well, bad weather, natural disasters, etc. So if there was something crazy going on, it's much better to try and do the birth process in like the person's house as opposed to in your ambulance on the side of a highway, right? So you have to kind of determine. All right, once again, contractions is the beginning of one contraction to the beginning of the next, okay? So it's 2 minutes and it's beginning to beginning. All right, yep, if you see that crown, we're doing it. Okay, you will not be able to maintain sterile conditions. It is not a sterile process at all, but you should still attempt to be as clean as possible, okay? Wash your hands. We'll talk about what an OB and obstetrics kit looks like and lots of towels, okay? So firm surface, but padded. And then we're going to elevate the woman's hips 2 to 4 inches. Okay, we're not doing 6 inches. We're not standing on her head. We're just doing a slight elevation of the hips, about 2 to 4 inches. Okay, so yes, this is a messy process, and C-section is no better. Both the birth process is just a messy thing. All right, so if you have an OB kit, they would look like this. It's just some of the suction and face masks and gloves and everything kind of comes in one little box. Okay, so there you go. That's some of the things that are in it. Now, if you do not have a delivery kit, look for equivalent stuff, right? Just look for the same kind of thing. Okay, so there's the equipment you need. All right, so there are 2 lives to be considered in the situation, obviously, right? The life of the mother and the life of the newborn. Now, some people get, and it's actually, I've seen it kind of happen both ways. They get tunnel vision on the mom because the mom's in distress and they kind of forget about the baby, at least when the birth process is happening, or vice versa. They get tunnel vision on that baby because it just came out, and then you kind of forget the mom. So remember, all of a sudden, you got 2 patients, okay? And so you need to keep an eye on both equally. Now, if everything is going good, the head should emerge slowly, and it shouldn't be too bad, right? They shouldn't be very complicated. The baby should kind of self-deliver. After that head and shoulders come out, it kind of auto-delivers. So the head will actually, or the whole infant will actually turn on its side, and it just comes right out. The infant will be wet and slippery. There's a thing called vernix. It's this kind of slimy stuff on the baby. So the babies are slippery, so you need to dry them off quickly. And then keep the patient's head about the same level. Okay, so there you go. So that's in a good situation. That's how it looks. Now, the embryonic sac, if it has not broken, tear it with your fingers. I know that sounds crazy that I'm tearing something in the patient, but that was kind of supposed to break on its own. So it didn't break on its own, now you got to do it, okay? So I know it sounds crazy, but tear it away, push it, and make sure that infant's head and mouth are clear. Now, if the umbilical cord is wrapped around the neck, you can slip it over the head. You can attempt. We don't want to pull on the umbilical cord, you don't want to pull on the baby or anything, but if you can tell it's around the neck, you can try and just slip it over. Okay, so clear the infant's mouth and nose, okay? We want to do the mouth first and then the nostrils. And the reason why is if we do the nose first, sometimes that'll stimulate the baby and he'll start to cry. Well, he inhales a bunch of junk to cry, and now you have, an infant with or a newborn with pneumonia or something. So mouth first, then nose, okay? All right, there we go. Mouth first, then nose. Okay, if the infant is not breathing, suction the mouth, and then the suction everything again, and then rub the back or the soles of the feet or something. And I'll put a video in the comments, but it's actually, you're stimulating it. You're like waking the thing up. Okay, so I know, and it also sounds rough that the baby comes out and you start shaking it around, but you take a towel and you dry off all that stuff, and then you kind of flick the bottom of the heels, and you just kind of wake it up. So you can clamp and cut the umbilical cord, know the time of delivery. Normally though, if you can, I would wait for an ALS, for like a paramedic rig or something, just because they'll have all the drugs and some stuff like that you're going to want for this. But if you have to, you can clamp the cord and then cut it. Okay, the placenta should deliver about a half hour after it's on its own, okay? Half hour, it should just come out on its own. All right, now, this is kind of what it looks like. So you have the placenta, and then you got the baby, right? So we want to wrap them in a towel, the baby in a towel, and we can place the placenta in a plastic bag, keep that warm, and then transport it to the hospital. And we're going to keep it at the same level at the infant. And the reason why is there's actually some fluid going back and forth between the baby and the placenta. So if the placenta's super high, then all that's going to drain into the baby, which is bad. It could overload the baby, or vice versa. The baby's too high, it drains all of its fluid into the placenta. So same level, okay? Same level. The mother's bleeding usually stops when the placenta is delivered, normal circumstances. Mom should not lose more than 500 milliliters of blood. You're gonna lose some blood. It's a messy process, but it should not be more than 500. If it starts to be a lot of blood, we call this a fundal massage. And basically what you're kind of doing is you're massaging the uterus and through the skin, and you're basically convincing the uterus to contract down and stop that bleeding. And that should take 3 to 5 minutes. Breastfeeding is also another thing that helps stop bleeding. So when that baby first comes out and there's some extra bleeding, 2 things you can do, super easy. Give the baby to mom for breastfeeding, and then do the fundal massage. Okay, so now we want to continue to watch both of them, take their vitals, keep them both warm, check the uterus for firmness. And remember, 3 to 500 is about normal. We don't want any more. There we go, clean. And now the mom can start to drink water and kind of start to recover once the baby is out. All right, ectopic pregnancy, just know what that is. Just be familiar with it. An ectopic pregnancy is a fertilized egg becomes implanted really outside the uterus. It is normally in the fallopian tube, but it could be implanted somewhere else. And obviously the fallopian tube is not meant to have a baby. So when that cell starts to grow and grow and grow, you can rupture the fallopian tube, and it can cause a lot of damage. That can even cause shock. So lots of abdominal pain, internal bleeding. At this point, it's a medical emergency. The patient's in shock. You need to take them to the hospital. All right, miscarriage is a spontaneous abortion. That's incomplete or underdeveloped fetus. Surprisingly, this is a lot more common than you would think. At least it was a lot more common than I thought when I was younger. But now that I have a lot of friends who are having kids, I know quite a few women who've had a miscarriage at some point, usually before 6 weeks, but It can happen. And basically, something happened along the way, and it could be a bunch of different reasons, and the baby just is not going to make it in the uterus. It doesn't survive, and then the body wants to get rid of it. Vaginal bleeding is usually the first sign of a miscarriage. And so if you have any sort of vaginal bleeding, you need to ask about, is there a chance she's pregnant? Any sort of, you don't, it's tough, especially for some of the younger populations, like if it's a teenager, to have this question, but diplomatically try and say, like, is there any chance you could be pregnant? Because vaginal bleeding, really 8 to 80, which I know sounds crazy, but in the medical world, we say 8 years old to 80 years old, you always have to be worried about some sort of pregnancy, labor situation. All right, premature birth, newborn weighing less than 5 pounds or earlier than 36 weeks. Okay, so you can write that down. That might be on the test. The parameters of what a premature birth is: less than 5 pounds or before 36 weeks. Okay, premature infants are smaller, thinner, and redder, but and yeah, sure, more red. But we're actually okay here. Some people are really worried about premature infants, but really those last few weeks in the uterus is all about developing and growing. Not so much like brain development. It's really just like finishing touches, right? So you could have that kid come out, put in an incubator, and a lot of times these premature infants make a full recovery. They live a totally normal life, no real damage from being delivered. So once again, just a reminder, if you have that unbroken bag of waters, you can break it and then make sure that baby's breathing. So a prolapse of the umbilical cord is when that umbilical cord comes out first, and then the baby's trying to come out, and now it can actually cut off the cord, and now the baby's not getting any nutrients, right? So this is a pretty tough one. We want to make sure there's a pressure off that cord, and these are going to be really, really hard to deliver in the field. So at this point, what we want to do is keep the cord covered and moist, but do not try and get back in. Give some oxygen, really fast transport, and then some EMS assistants recommend placing women in a kneeling position or bringing the knees up the chest, that kind of thing. That might help reduce some of that pressure off the cord. All right, a breech of birth is one of our, I'll say, different presentations. So we like the one where the head comes in, the body rotates out, cool, but there's a few other ways it could go. Breech birth is when the buttocks come out first, nothing you can really do. I mean, you can deliver these in the field. It is possible, but as you can imagine, you got the hips and the legs, and there is a little maneuver where you can kind of reach inside the pelvis and you kind of slide out the legs. These legs they're not necessarily fully developed bones yet, so there's a little bit of wiggle room there, and you might be able to get the legs out. But at the same time, don't be surprised if you're going to have to go to the hospital and they're going to have to be there. Then there you go. So they're saying about 3 minutes, we're going to call it and run to the hospital. If it's a limb presentation, which is when the limb comes out first, that's it. There's nothing you can do about that. All right. So try and supportive care, keep the mom happy, keep her breathing, and go to the hospital as quickly as possible. Stillborn delivery. This is when sometimes these stillborn babies can be almost full term. But for whatever reason, in the last few weeks of labor, or a few weeks of gestation, they just didn't make it. So the body will definitely want to expel this because it'll actually start to decompose inside. It will not exhibit any signs of life. It will not look good. These can be psychologically damaging to everybody in the room. Okay, so stillborn delivery, we do want to maintain it, and we do want to take it to the hospital with the patient and everything, but just understand that there's a psychological toll to a stillborn delivery. All right, multiple births, just in case you have a woman who's got twins or something, it'll just be giving birth twice. So the baby will come out, and then the second set of contractions start, and it's basically repeating the same cycle. Okay. And then just as a reminder, we can try and elevate for excessive bleeding. We can try and put some sanitary pads there to soak up that blood, elevate the hips, treat for shock, arrange for transport, and of course, fundal massage and breastfeeding if that has not already been done. Okay, so the two last things we're going to talk about, these are just kind of complications. So just know what these two things are. Placenta previa, it's kind of in the name there, previe, before. The placenta is blocking the exit. So It's like if you would look in there, we're going to see the placenta and not the baby. All right. So that's usually is painless, bright red bleeding. Usually requires a C-section. Okay. And so placenta previa is when the placenta is blocking the baby from exiting. Okay. It's like the bouncer. Well, it's like the bouncer for the real world. It will not let the baby out. Okay. So we have to do C-section. And the last one is the abruptio placenta, which is when the placenta is in a good position, but it detaches from the wall early. And this can be, this can have a lot of pain, this can have a lot of bleeding, and these patients also usually require a C-section, all right? So just be familiar with placenta previo and abruptio placenta, okay? Just know what's going on with the placentas in both of those. The last thing about this is just for pregnant women in an accident. Well, dead moms produce dead babies, so let's make sure we're doing everything we can for the mom. And one of those things is going to be we want a woman to lie on her left side because when she lays right on her back, that baby can actually put some pressure on her aorta and reducing blood flow to the rest of her body. So if we have any sort of shock situation, we want to lie the patient on her left side, which is going to relieve a little bit of pressure off that aorta. So that was it, guys. Down and dirty birth. It's something that is on its own timeline, and I can tell you, working on the few floors I've worked at, there's just no way to know if this labor process is going to be 8 hours or 18 hours. It's just there's lots of variables involved. So just remember those 3 stages of birth and some of the different presentations, and I think you guys will do just fine on the test.